Hello. So there's a lot of people who have been wondering what is going on with me, and so I feel like just I'm ready to share. And so if you don't already know, I was diagnosed with thyroid cancer a few months ago, and it's been a really rough few months. It's been a lot of ultrasounds and CT scans, PET scans, biopsies, and a lot of like second, third, fourth, fifth, sixth opinions, and just trying to figure out what actually is going on with me. And so it was determined that I have metastatic thyroid cancer. And so it's in my thyroid, or it was in my thyroid and in my lymph nodes, just on the right side of my neck. So we hope that it just was in the thyroid and the right side of the neck. There is a tiny possibility that it's in other places, but the PET scan didn't show anything. So we're pretty hopeful. And so anyway, I've been trying to wrap my mind around the treatment and like just what the future looks like and what this means for my life and for baby Emma and for Nick and my family and all those things. And so ended up having surgery on Tuesday, May 18th, just a few days ago, and was discharged the following day. Thankfully surgery went perfectly. My surgeon is a total rock star and got everything out that he thought looked malignant, and so I'm home and just recovering. I had a drain in. If you want to see this gnarly incision, it's still super swollen, and healing obviously, but since the drain came out, I feel like that pressure, had this pressure that felt like I was being choked, and that's gone, thankfully. So now we just heal. Thankfully, and I'm so grateful that the nerve that supplies my vocal cord was not affected, and neither was the nerve that supplies my upper trap, so my shoulder works just fine. Those were kind of my two biggest fears, and so those things are good. Just my voice is a bit raspy and hoarse at the moment, but that should resolve with time. So healing can take a while, obviously, but just doing the best that we can for now. And yeah, so what is coming up next? Going to be waiting on results from pathology. So all of the thyroid and the lymph nodes that were taken are being sent to pathology, and they're going to be checked for to determine whether they're benign or malignant. And then depending on what those results are, I will have to do what's called radioactive iodine treatment. And so I'll just swallow a radioactive pill of iodine, and it's supposed to go in and into my body and kill any remaining thyroid cells that are living anywhere, any microscopic disease that they couldn't catch intraoperatively. So that's a little scary because there's a lot of potential complications from that, but I'm just going to do everything I'm told and drink all the water and suck on all the lemon, and hopefully I'll be alright. And that should be happening in like 8 weeks or so. After the radioactive iodine, basically I'll do like a full body scan and just make sure that nothing lights up that would indicate that there's any remaining thyroid cell anywhere. I think they do some blood tests and things just to check for like markers, make sure everything looks good, and then hopefully I'm good for a while before I have to do like more blood tests and scans and stuff. So it's kind of something we just have to monitor forever. But yeah, so just really hoping that pathology comes back really clean, and that I heal really quickly, that my pain gets better managed, because literally no amount of pain medication is helping at all. So like it's hard to like move my head in any way, and like talking, swallowing, breathing. If only I could just not do any of those things, life would be great. But So that's where I'm at right now, and so I just really want to kind of come out and share this stuff, because I feel like when I was getting diagnosed and going through all these tests, I could not find resources, people to connect with, or anything that could give me any type of hope or like security or just connection, and it was just very lonely and just hard to kind of just hard person who's kind of going through it too, and to share my experience and just hope and stuff. So yep, I'm here, and I hope you guys will keep me in your prayers, and yeah, big hugs. Hope everybody's good. Bye bye.